All right. Well, it's 8:45 and time to get started. So welcome everyone to our February Health Innovation Community Partnership meeting. We're always delighted to have you join us for updates about programs, policies, initiatives, and priorities impacting the LA General Medical Center and its surrounding communities, as well as residents across the larger region. With that, we'll go ahead and kick off our February meeting. Just a reminder that we have scheduled all the meetings for the remainder of 2024. Please make sure you're registered for every one so that you can join us here on a monthly basis. Our next meeting will be on Friday, March 1st. As you know, this is a Zoom hosted meeting, clearly, because you are here. We want to make sure that this is an interactive session. So we ask everyone to, turn on your cameras if you're able. Please start the meeting on mute, but feel free to unmute yourself and ask questions or put comments or questions in the chat at any time. We'll make sure that there's time for dialogue and conversation around the topics presented today as we translate the items in the chat and bring those comments and questions forward. Again, another reminder, this meeting is recorded and will be posted on the hicpla.org website in about a week's time. Oh, and one final note. There is an interpretation globe at the bottom of the screen on your tech toolbar. We ask everyone, regardless of the language you choose, to please select that so you can fully participate in comments, questions, and dialogue throughout the meeting. We'd like to acknowledge that February is Black History Month, and we're very excited to have a presentation today that'll talk a little bit about some of the issues, health issues, that is, facing African Americans. But we just want to acknowledge February as Black History Month and just celebrate the centennial birthday of Black History Month. We also want to acknowledge that February is American Heart Month. So again, just acknowledging and recognizing heart health in the month of February. So please take care of your heart and yourself during this month of February. And finally, of course, it's unusually a leap year and a leap month this February 2024. So we will have the unusual experience of celebrating 29 days in February. So hoping you have something special celebrated on that leap day to acknowledge this tradition that only happens every 4 years. With that, we'll go ahead and kick off our agenda, or I'll describe the agenda to kick off the meeting. We will start today with our meeting overviews, guiding principles, and announcement. That's this. And then we're always delighted to welcome Jorge Orozco, the CEO of the Los Angeles General Medical Center, who will give an update on campus happenings. We have a couple community health updates to speak about issues in our community. And then we'll be hearing more about the campus projects and some updates there on what's going on our campus. And finally, we're going to spend a little bit of time with all of you talking about how to make these meetings the most impactful and beneficial to you through the course of the rest of the year. So we're going to be asking you to put your thinking caps on and identify topics, speakers, organizations that you'd love to hear from in the year ahead. With that, I'll go ahead and read our guiding principles. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. As a reminder, we have a survey as part of our conversation about what you would like to see with the HICP meetings in the year ahead. I'm going to ask my colleague, Elijah, to please put the survey link into the meeting chat. So please click through on that through the course of the meeting, answer those questions for us, and then, of course, we'll have some time for discussion and dialogue at the end of today's meeting. And with that, as always, I'm so delighted to welcome Jorge Orozco to share with us some of what's going on the Los Angeles Medical Center campus. Jorge, welcome.
Hi, good morning, and good morning, everyone. Thank you all for having us here. It always is a pleasure to interact with this important group for us that provides guidance to what we're doing in the medical center. Today, we want to provide an update on our efforts on EDIA, our Equity, Diversity, Inclusion, and Anti-Racism Initiative. And I just want to start by providing a little context. So LA General is part of a bigger LA County system. And as such, we've recognized that this big bureaucratic system may have policies that exclude certain individuals, certain employees, provide opportunities to certain individuals more than other individuals. As a medical center, it is very likely that certain groups are being served better than other groups. And, we're a big organization with a lot of purchasing power. And it is very clear that our money largely goes outside of our community. And, these are issues that are important to us to be a sort of steward of what we're doing in a very equitable way. And to that end, we've engaged in this EDIA initiative across the Department of Health Services, but particularly at LA General. And we've made an investment in ensuring that we have structures to be able to sustain this initiative over a long term. And so we've hired an amazing person, Erica Braxton, who's our Chief Engagement and Equity Officer, who will be providing an update on kind of where we're at, what we're doing, and be able to answer any questions. So thank you so much. Erica.
Good morning, everyone. Jorge, thank you for the introduction. I'm so excited to be here to talk a little bit about EDIA, not just here at LA General, which I will spend the majority of my time talking about, but the initiative across all of DHS and even across all of LA County. So like Jorge said, my name is Erica Braxton. I am LA General's first Chief of Equity and Engagement. I'm so excited to be here. I started this role in June of last year. And while this is my first time working for the Department of Health Services, it's not my first time working in EDIA. I come to LA General with about 15 years of EDIA experience. I've had the privilege and honor of working with state departments like the Department of Housing and Community Development and the state's regional center system, as well as LA County Libraries and American Honda. So I'm super excited to be here and to bring that knowledge and insight to this particular organization. So for the next 10 minutes, I'm going to talk to you about what EDIA is, how the EDIA initiatives we are implementing at both DHS and LA General is really going to transform and address the way we think about health equity. Next slide, please. So EDIA is an acronym that stands for Equity, Diversity, Inclusion, and Anti-Racism. And the Los Angeles County launched its EDIA initiative in the summer of 2020 following the brutal televised murder of George Floyd. LA County Board of Supervisors issued a powerful call for a countywide anti-racist agenda, and executive leadership at both DHS and here at LA General answered that call by really launching an initiative that seeks to root out systemic racism here within health services. Next slide, please. So our EDIA mission here at DHS is to advance equity and justice for all patients, workforce, and communities in which we live, work, and serve by providing quality, trauma-informed care, strengthening community-based collaborations like this one, and dismantling systemic anti-Black racism, and creating an inclusive, anti-supremacist, and culturally responsive environment. I know that's a lot and a big goal, but it's worth it because our patients and families deserve it. Next slide. So within DHS, our EDIA structure includes our DHS director and executive leadership team, which Mr. Orozco sits on. We also have an EDIA advisory group, an EDIA council who help put together our EDIA strategic plan for the next 2 years. And we have EDIA subcommittees at all DHS programs and medical facilities. We also host an affinity groups that represent all types of cultures and affiliations across LA General and the whole DHS system. Next slide. So at the DHS level, our EDIA strategic priorities for Q1 and Q2 of this year is to conduct a health equity assessment across the entire enterprise to really establish a baseline and see and begin to truly understand where the health inequities within our system lie. The 2 assessments we're currently considering implementing is one from the Institute for Healthcare Improvement, and there's another one that we just received this week from the American Hospital Association. This year, we're also working on creating an EDIA onboarding training for staff to undergo during new staff orientation. This is essential so that everyone coming into the DHS system understands our anti-discriminatory policies and how they're implemented throughout the system. Very important. The final thing we're doing at the DHS level is we are a part of SNI's Racial Equity Community of Practice. And this is a practice of safety net hospitals across the state of California who come together to discuss best practices and frameworks that we can implement to really try to shift the needle in the entire safety net system here in California. So big goals. Next slide. So now we're going to talk a little bit about what this strategic initiative looks like here at LA General. Next slide. So over 60% of the patients that come to LA General for medical care are Hispanic and primarily Spanish speaking. The goal of providing healthcare services in language of preference has been a priority at DHS since 2018, 2019, pre-pandemic. And the expansion of our language access interpretation services has been an initiative in motion since 2020. So essentially, here at LA General, we have the largest language access program across all of DHS. And the goal for this year is to really continue to expand that. Right now at LA General, we offer 24 hours, 7 days a week access to interpretation services. These services come in the form of face-to-face interpretation. We have 24 interpreters on site here at LA General that is ready at any moment to come and support our patients as they navigate through the healthcare system. We also offer video interpretation and document translation, as well as virtual healthcare and integrated video visits. Last week during Interpretation and Appreciation Week, we really tried to highlight these services for our staff here because they are essential for making that reference and connection for patients who need interpretation services. So we created a flyer and a rotating screensaver, and really our goal for this year is not only to expand the program, but to increase utilization. We know that patients and families need interpretation services, and this is something that should come very easily as they enter into our system and navigate for healthcare. Next slide. So next, I want to introduce you to LA General's EDIA subcommittee. They're pictured on the screen here, and talk to you a little bit about their purpose and plan for the next 2 years. Next slide. So let me start by reading the purpose statement for DHS's EDIA committees. So EDIA committees are essential to our department, serving as champions of equity, diversity, inclusion, and anti-racism within DHS. These committees involve diverse perspectives and comprise workforce members from various roles and identities. Our EDIA committee members use their unique lens and subject matter expertise to focus on engagement, education, and awareness across the DHS enterprise. I have had the honor and privilege of working with LA General's EDIA committee for the last 7 and 8 months, and they have big plans, let me tell you. So next slide. So here are some of the objectives of the committee. They definitely work to provide two-way communication between the facility and EDIA leadership. They really do work to promote inclusive and equitable leadership from our facilities, and they work to collaborate and connect, the EDIA initiatives with the work actually being done on the ground. So they are essential to the movement of this work forward within our facilities. Next slide. So the two primary goals of our EDIA committee when I started in June was one, to increase its size. When I first started, we only had 5 members and we had 0 patient and community members. And our charter states that we definitely have to have community members part of the EDIA committee. So from June to September, we launched a huge recruitment campaign, and I'm glad to say that our committee has grown. We now have 12 members and 1 member of our PFAC that also sits on our EDIA committee. We held our first full body meeting in September 2023, and we have been working on creating a strategic plan for the next 2 years. That strategic plan includes initiatives in the areas of population health, community outreach, workforce development, and quality safety/patient experience. Some of the things our committee wants to do is they really want to dig into SOGI and social determinant of health data to help us really understand where those gaps are and create initiatives to close them. They would like to launch a summer internship pipeline program so that we can expose more youth of color across LA County to the amazing opportunities of workforce here in healthcare. There's so many amazing roles folks can play. We want kids to be open to that and start planning before they even think about college. And then we want to develop 2 to 3 EDI trainings that we can have go on across campus at various meetings with different groups, so we can start working on things like implicit bias and gender affirmation as mindset shifts for our whole staff. So really our strategic goal for this year is to implement this plan and get traction on it. Next slide. So outside of the work of our EDIA committee and our language access services program, we do here at LA General accomplish a lot through our on-campus cultural celebrations. At the end of this month, we'll celebrate Black History Month, and we also have celebrations around Asian Pacific Islander Month, Juneteenth, Hispanic Heritage Month. And believe it or not, these are not only opportunities for our staff to come together and celebrate, but also to learn about cultures outside of themselves. Research shows that that is one of the strongest ways to tear down the walls of implicit bias. It's just having exposure to cultures outside of your own. So we really look forward to bringing these types of programs here to LA General. We've also been working really diligently to prepare LA General to meet the next set of health equity standards that both Joint Commission, Leapfrog, and CMS will be assessing us by during our next recertification visit. These health equity standards require us to refine and clean up the way we collect real SOGI and social determinant of health data and create a pathway to connect patients to the resources that they need to help mitigate their impact. This is actually where our partnership and collaboration with this group will become so important. We look at LA General and the Wellness Center, we've been doing this work for years, connecting patients and families to resources in community. I think now our goal is to really just streamline the identification process and streamline the process that we use to connect them to the actual resources. I'm excited about this work. I hope you can hear it in my voice. I tell Jorge all the time, this is my dream job. He said it would wear off after a month. It is totally not worn off. I am so excited. And I am excited because one, I know that we can do it, but also because I know how important and impactful this work is. So I'm going to stop talking and I'll leave it open for questions. If anyone has anything that they want to know more about, I am here. And thank you so much for allowing me to share some of the great work we've been doing in this area.
Well, thank you so much, Jorge, for the introduction. And it's so wonderful to have you join us today, Erica. We're delighted to know more about your role at Los Angeles General and these incredible priorities and initiatives that are happening here on our campus. It could not be more timely, and it's so exciting to be part of this conversation. Well, I'm delighted to announce we have some questions in the chat. I'll take them in the order I saw them. Dr. Carla, would you like to ask your question?
Hi, everybody. Good morning. Erica, thank you so much for this beautiful presentation. I saw the picture of the team, and it's like an awesome, fierce team. I am so happy. I know that there was a time you were looking for more people to be members.
Yes.
Are you still looking for
We are
folks?
still actively recruiting. Yes, our target number is 17, so we have about 5 or 6 additional seats available on the committee. And yes, so please, if you have anyone that you think would be a great fit, right now the commitment is about 2 hours a month. I think that's going to bump up a little bit to 4 hours. I think DHS is considering a proposal to increase protected time. So just so everyone knows, our staff is given protected time to participate in this committee because this work is so important to what we do. So if you have some great candidates, please send them my way. There is an application process, but I can walk them through it.
And our next question is from Elizabeth Harrell. And welcome, Elizabeth. I saw in the chat that this is your first meeting with us. We're delighted to have you join us today.
Thank you so much. And you can call me Liz. Erica, I don't know if you remember me.
I absolutely remember you, Liz. When I saw your face, I was like, oh, from my
It's
regional
so
center days.
nice to see you.
Yes.
I'm from the Eastern Los Angeles Regional Center. I'm the Director of Community Services there. And I know Carmen Castro Luna, who's one of our supervisors over our community engagement unit, is also on the call. We were excited to start participating in these meetings,
Yes.
learning about the development that's happening and affordable housing. But we're just both chatting with each other going, this is just terrific and amazing. And so I just wanted to, first of all, introduce myself to the group, but also, Erica, if you are, and the question was answered, if you're continuing to recruit, certainly we want to be a community partner with you. The folks we serve live in Boyle Heights, City Terrace, Northeast, LA, Lincoln Heights. So certainly you can reach out to me or Carmen. I'll put my email in the chat so that
I
we
would
can
love
help
to
you with
have someone from
some
Regional
representation.
Center. Yes, that would be perfect. A lot of our work intertwines,
Absolutely.
and my history with Regional Center, I've already been thinking about ways to partner. So this would be
Terrific.
great. I think it would be amazing. Yes.
Great.
So I will for sure reach out to you. Thank you so much.
Good. Thank you. So good to see you.
Yeah, it's good to see you as well.
Wonderful. Well, this is one of the things we love to see at HICP, connections being made that strengthen service and care of our community. Do we have any other comments or questions for Erica? Well, I think it's wonderful news that you're still in the recruitment phase, Erica.
Yes.
How best can people reach out to you if they're interested in
Yes.
applying or learning more about the opportunity?
Yes, absolutely. You can email me. It's Erica Braxton, and it's ERIKA Braxton, all one word, at dhs.lacounty.gov. And I'll drop it in the chat.
Fantastic. Thank you
All right.
so much. And we are
Yes.
delighted to think about EDIA trainings coming to our campus.
Okay.
And I would love to speak with you about the opportunity to bring it to the community-based organizational partners that participate on and around the campus, because I think this is definitely something we'd all love to make sure we're tracking on with our various organizations and addressing in the best way possible.
That would be an amazing opportunity, Heather. I welcome that. Thank you so much.
Fantastic. Well, any other questions or comments for Erica or Jorge? All right, well, I guess we're ready to wrap up this segment of our presentation. We do look forward to promoting African American History Month celebrations. I believe they are, can you remind, if you remember off the top of your head, Erica, can you remember the day that those will be happening here at LA General?
Yes, it'll be on the 28th. And I believe it'll be inside of conference room A and B. So please stop by. We'll be having tabling. I believe there'll be some performances, and we'll be speaking about the impact of African American history on the healthcare industry. So it should be a good day.
It is always a wonderful day, and it is a true celebration and a joyful experience. So yes, please come join us in conference rooms A and B in the inpatient tower at LA General to, like I say, to enjoy the resources, learn something, and of course, be entertained, because there's always good music there as well. All right, well, thank you so much, both Jorge and Erica. Always wonderful to hear about the things that are happening here at LA General, and particularly how this is such a leading organization for healthcare and wellness in the community. With that, we're very excited to invite, we have 2 presentations on community health here with us today. We have a presentation on the African American Infant Maternal Mortality Prevention Initiative. And I believe Adoja, if I might have gotten that right, I think you're already here with us ready to speak. Is that right?
It's Adjoa.
Adjoa, thank you so much, Adjoa Jones. We really appreciate you joining us here today for a presentation.
Thank you. I will need screen sharing.
Okay, I will stop my sharing so you can jump in.
Thank you. I appreciate it. Good morning, everyone. I'm glad to be here, thankfully invited by my colleague. Make sure I got the right screen up. Let me know when you can see it.
Will
So
do.
my colleague Felix, that I used to work with at Whole Person Care, who's now with us at Public Health, invited me today. So him and Heather invited me. So you all bear with me, regular day off, but I'm hopping in here with you all to share about the exciting work of our AIM Prevention Initiative. So as Heather was sharing, my name is Adjoa Jones. I'm the Director of Outreach and Engagement, and most recently, our California Abundant Birth Guaranteed Income Expansion Project. And I work with the Department of Public Health in the MCAH Health Promotion Bureau Division. So I'm gonna speed through these at some point. If you have questions, feel free to drop them in the chat, because this is generally longer than it's a longer presentation. At any rate, my director is Dr. Melissa Franklin. My colleague Helen and I are both lead directing the AIM Prevention Initiative with various segments, which I will share with you throughout of where we are with our prevention initiative. I will let you know this prevention initiative started with just a small, I won't say small, but a vision of mine to create a community action team based upon my work in whole person care. And that community action team was to focus on African American infant and maternal mortality. So just to let you all know, just with a little small dream and vision, we now have a unit and are doing great work throughout our entire county. So super excited about this work, and some of what Erica has mentioned. We've been able to not only expand the Black birth worker pipeline, but the entire birth worker pipeline through some of the work that I will share with you. So this presentation will focus on our AIM basics, provide you a brief data update, talk about some of our progress, structural elements, our programmatic achievements, what we are looking ahead to, and how you can connect with us. AIM is a coalition of the LA County Department of Public Health, First Five, along with DHS and Department of Mental Health. It also includes many of our community-based organizations, individuals, community residents, not faith-based organizations, as well as clinicians and birth workers. And it is open to all. Our main goal is to eliminate the inequity in birth disparities, especially Black birth disparities. Also, to really ensure that Black mothers and birthing persons have a joyous and celebratory birth, as well as healthy birth and pregnancy outcomes. What are our values? Our values in AIM are racism is the root cause, Black women up front and leading, fostering equity while fighting inequity. Everyone has a part to play in this, so we're all part of the puzzle. So those puzzle pieces come together and we fit in a unique way, but actually fit and jointly successfully work together. There's also no blame game here. Birth outcomes are a result of systemic issues, not focused on an individual's woman's choices, but some of the issues that we face, especially for the descendants of the African slave in over the past 400 years here. Very grateful, especially in this work, being able to share racism as a root cause. And one of the things Dr. Ferrer expressed when they started the Center for Health Equity, that it was one of the highest causes for infant mortality, and we have found the same for maternal mortality. What is our framework? Much of this work started when many of us started putting information and partnering when we were a health agency to create the 5-year equity plan. And so hence we have definitely passed those 5 years, but when we started in conversation in 2017 and 2018, the strategies were to reduce women's exposure to stressors in the social environment, to block the pathway from social stress to physiological stress, some of which we have done, and I'll share with you about our perinatal equity initiative, where we offer doula support, group prenatal. Strategy 3, intervene as early as possible if when stress has taken a toll on the health with clinical practice improvement. Also, we have preconception and postpartum care and some trainings and partnership to share and offer clinicians and birth workers preconception health training and dialogue on what would best serve the community and how folks with lived experience are expressing their challenges and issues they have had in our clinic settings, as well as with our community-based and social service, community-based organizations and social service providers. Strategy 4, create an infrastructure needed to achieve 1 through 3. So we formalized our partnership with First 5 LA, as well as created a countywide steering committee and formalized some of our partnerships and collaborations with our nonprofit organizations and community-based organizations, as well as building relationships with private funders throughout not just California, but the nation. And also increase the data capacity, more sharing and trying to get real-time data as much as possible and provide it as soon as possible. Just briefly, I'll go through the data update, much of which and why I started this. I have been doing this work since the 90s with being the first Black infant health program, community health worker and perinatal health educator, and saw that we had always had high rates of infant mortality, and we had never gotten to the halfway point from this orange line here represents African American infant mortality rate over a 3-year average. And so we had never gotten to a halfway point in LA County, which for me was a bit disturbing, being a public health leader, that we had not figured out a way to really address and solve this crisis in our county. So like I shared, this is the orange line represents African Americans, the blue line represents white, the yellowish line represents Hispanic, and then Asian is the green line. So you can see that African Americans infants are dying at 3 to 4 times the rate of white infants in our county. Infant mortality rate by mother's race and ethnicity in our county, similarly the same, and it's just showing we've been able to bring this up to 2020, and we're looking hopefully to at least get data up to 2022. And as soon as we have that data, we'll be sharing that out. But it represents, most of you know, but some are community-based organizations, and I don't assume that everyone here knows, is the death of an infant before their first birthday. Why this was even more important to me is that CDC was reporting back when we started in 2018 that we were losing at least 4,000 Black infants before their first birthday in our nation. And we're still looking to get some of that real-time data. We know much of that has not changed, especially as we have been in and out. I guess we'll say we're post-pandemic, but sometimes it doesn't always feel like that. At any rate, this is our representation of what the infant mortality rate is by race, mother's race, and based upon our various SPAs, our 8 service planning areas. And initially, when we started, SPAs 1, 6, and 8 had the highest rate of infant mortality. But as you can see, those numbers have increased in Metro LA, San Gabriel, as well as SPA 7, so the East LA area. And so much of that has to do with where Black women reside as well. And so we've actually moved throughout our county, so that often has been a part of the change. Similarly to the other sides, I want to move through so we can get to it. And I will share this with Heather so she can provide it to you all if you're interested in seeing or having this presentation. One of the things that was most concerning, because some will say, well, why African American and why is it such a big issue? If you look at this chart here, it also shows where the live births and infant deaths are occurring based upon race, and also the number of births and deaths that are occurring. So as you can see here in 2019, there were 8,050 live births and 74 infant deaths. So looking at that shows you why this is of vast importance to us, because we're having lesser births but higher death rates based upon the number there. Maternal mortality. I'm very excited that in LA County, there was a huge focus always on Black infant mortality and morbidity. And when we started the AIM Prevention Initiative, and when I came up with the idea for the Community Action Team model, I was able to convince public health to start to focus on maternal mortality and morbidity. Hence, now the Black Infant Health Program, the statewide program, is now including maternal mortality and morbidity in their work as well. So we're super excited about that, but we were able to start to look at the data and see what were the maternal mortality rates for our county. We always knew that from the state level, it was shared that Black women were dying at 3 to 4 times the rate of white women. But in actuality, when March of Dimes and MMRC put together a report, we found that Black women were dying at 4 to 6 times the rate of white women throughout California. This also shows the 5-year moving averages. And as you can see here, African-American maternal mortality rates are off the chart in comparison to other races. So one of these, what we were able to use and really share throughout when we started this was a Moms Rising, which is a organization that really focuses on all issues surrounding moms, put out this data fact and point to share that Black women in the U.S. are 243% more likely to die from pregnancy-related causes than white women. And this was a big issue because this also started to show forth that Black women coming from all socioeconomic backgrounds, no matter whether they were college educated or not, were faring worse than white women who had not completed high school. And so this was a big issue, and most were looking at, well, oh, we're not paying attention to the average working woman. And it didn't become much of a concern sometimes to some people until they saw Serena's issue, they saw Beyonce had an issue. But we're talking about the everyday working woman like Erica, myself, and some of the others and your peers. We've had, I noticed, and even during the pandemic, we had a leading pediatrician die within days of giving birth to her infant. And so this is not uncommon, and it's not just happening to those who are what we would say maybe from a lower socioeconomic background. So where's our progress? This actually has changed. We used to call this our AIM flower, now we call it our garden. So we started off just with like the South LA South Bay Community Action Team. We now have 4 community action teams: San Fernando, Santa Clarita Valley, San Gabriel Valley, and Antelope Valley. We have a doula advisory committee. We have an LA County-wide steering committee. We also have, we had a hospital collaborative, which was Cherished Futures for Black Babies. We just sunsetted that program. One of our partners, Charles Drew University, has created the Black Maternal Health Center of Excellence, which was recently funded. They're funded 5 years, $9 million from HRSA to create more maternal health centers throughout our county. Started first in South LA, and then they created one in Antelope Valley. So we're looking to see much more work that is being created here, and we'll continue to share out with you about that. So as I share, we have a countywide steering committee, the community action teams. We also have the AIM Village Fund, where individuals that may not even have a nonprofit or a community-based organization, but those that might provide services to Black moms and infants or their families are able to apply for this grant and receive up to, I believe it's $30,000 to be able to provide services. They're also taken through a cohort where they're offered training, they're offered key elements to furthering their business or their work, and then they're also providing the services and integrating into our various programs. We have public awareness campaigns. Some of you might have seen some of our billboards throughout the county, but we're sharing quite frequently about the importance around doulas, the importance of Black fatherhood and engagement there, as well as our various programs and support that we're offering to moms and their families. We were also able to get funding from the Perinatal Health and Equity Initiative, and also, I should say first, our AIM doula program was started in 2019 with funding from Whole Person Care. So DHS did support that funding, our initial funding, hence the pilot is now more of a permanent program, and we're getting other funding from like through home visitation dollars and some other programs. Through our Perinatal Equity Initiative, we offer group prenatal care. And as I said, Shared CDU, Black Maternal Health Center Excellence, is one of our partners that provides that. We also have our Fatherhood Engagement Program. Davion Malden is our program provider of that, and I'll share more about his in a moment. So our community action teams, the purpose of the community action team was to create a partnership, a 50-50 partnership between community and government to identify gaps in services and resources, create interventions and strategies to address the issue of AIM. And really to look at ways that not only could we reduce infant and maternal mortality, but those morbidities, those 50,000 near preventable morbidities that all women face throughout our nation at CDC reports. So as I shared, we have the community action teams. They serve SPAs 1, 2, 3, 6, and 8 at this time. Won't go through all these activities, but I will share with you, we thankful to our Board of Supervisors, like we have April 11th through 17th is considered Black Maternal Health Week as created by the Black Mamas Matter Alliance. We have been participating in that since 2018. We're excited to get partnership and sponsorship for one of our community baby showers that we've been doing the last couple years. And it will be sponsored by Planned Parenthood LA. So we also have many sponsors that provide support and services like California Black Women's Health Project, Black Women for Wellness. And this last year, I will say for 2023, we spent a lot of time supporting the fathers who lost their spouses here and girlfriends here in LA County, which was a partner of April Valentine, Nigel Robertson, and Freddie Cromer, whose wife Bridget died and left 5 children behind at California Hospital. So we've spent much of our work supporting those dads and looking at ways to have a maternal mortality crisis response, as well as for those who suffer losses that we consider the silent losses, either the stillbirths or the miscarriages. But this is some of the ways in which we do that. We have, when COVID happened, we had to figure out how to pivot and not quit our work. And we were able to create virtual, what I call virtuality, because, the young folks back then were talking about what's the T. And so the RT was virtuality. And so we would have these monthly offerings on various topics. 2 of our community action teams were created during the pandemic. So we're super excited about the work that has continued. Heather, give me a time check because I do want to not go over for you all, but this is just some of our visual of the work that we're doing in the community.
Yeah, please continue on. But if we could wrap up maybe in the next, couple minutes, and then we'll open it up to some questions. But thank you so much. This is such a powerful topic.
Thank you. What are our new structural elements? We brought in an outside evaluator. Our strategic planning process initiated in 2022. We're getting ready to start implementation of that this year. We also have expanded our AIM policy and advocacy work group, and thankful to Diamond Lee, who's the director of birth equity for DHS Mamas, who is leading the work and has been a co-chair of our policy and advocacy work group. And so we're going to be launching an advisory mother board where folks will be provided a stipend. We'll have mothers, at least, I believe it's 8 or more mothers from all over our county, to be able to learn about policy and advocacy and to be able to come in with their lived experiences, or those who desire to be parents in the future, to be a part of the work that we're doing and support those things that we have supported, like SB 464. I would encourage you to take note. We're working with Black Women for Wellness and the Attorney General's office that it is a requirement that the racism and implicit bias training be done. Our Attorney General is going throughout our state to ensure that that training is being done. Our folks will be deemed appropriately and accordingly to that. Also, SB 65, which was a California omnibus. Diamond, myself, and 2 other colleagues brought the first doula board motion to our county and was approved in January 2020, which was the impetus for some of the key elements of SB 65, which was the California Omnibus. And now all women who are birthing persons who have Medi-Cal and are interested can receive a doula. And so we are really in support of much of that work and looking at other ways folks can get involved. I'm not going to take you through the full portion of the doula program because my colleagues normally share that, but these are some of the elements. And what the doula program was created was to serve all African American women throughout LA County with doulas that are African American, are look like them, and could share and acknowledge the experience that those women in our community have faced and support them throughout their pregnancy and birthing journey. Eligibility, 18 or older, no insurance, income, or gestational age requirement. Ashley Skiffer Thompson is our current doula lead, our program manager. We will be having some transitions because we are still growing the AIM community, AIM prevention initiative. How you can reach them is at aimdoulas@ph.lacounty.gov. This is a fully staffed program. At the end of 2023, we had over 880 referrals, 300 current clients, and over 400 births. Outcomes: increased breastfeeding, reduced C-section, increased connection to maternal health services. Davion, our fatherhood engagement, provides 5 weekly sessions for expectant dads. So this, much of our programs are for fathers of African American children. They don't have to be Black, but it would be, if they are fathering African American children. Though I believe there has been some expansion on our expecting fathers group because we do want to ensure that fathers are aware of some of the issues that their partners or their children may face. Next step: sustainable funding, sustainable infrastructure, and continuous building of our community member engagement and partnerships. One of the things I did not share, and this is a slide that I share on some of the women, and I actually have others that I'll be adding. I just got a call on Monday that we lost a mom in South LA who was the mother of a 3-year-old and a 9-month-old that died from a heart attack. And so her husband will be left to rear those children on his own and navigate the system. And so these are the things that we are constantly addressing and dealing with. I will share that we just started on Monday, launched our California expansion of the Abundant Birth Project, which is a guaranteed income pilot program, which in LA County will be offering for eligible women. We do have a list of criteria. I will share those flyers and slides with Heather. But moms who are 8 to 27 weeks will be able to apply, and they'll enter a lottery system, which our first lottery drawing is this Monday. And we have a set of requirements. It is to basically reach the most disenfranchised in our community who have faced the most inequitable birthing and pregnancy experiences. And it will be an 18-month opportunity of funding for 18 months at $807 a month. And so it's a 12-month enrollment period that we will be providing a lot of information coming out to our community organizations and sharing. We'll have abundance coaches, which is different from most guaranteed income pilot programs because they will be able to serve those moms throughout their enrollment in the program. And so we're still hiring, still onboarding, so give us some time. We actually have already about 89 folks who have applied, and over half of them are in the eligibility phase. And so more to come. But if you want to reach me, you can reach me at ajones@ph.lacounty.gov. Learn more about our work on our blackinfantsandfamilies.org website, as well as we have Twitter, X now, Instagram, and Facebook. Thank you. Try to rush that, you all. I'm sorry.
You
Doubling
got
those
that
words.
through it. Very impressive with so much to share, but you know, it's such an important topic, and we're so grateful for the incredible work and just leadership that you and your team are demonstrating in this very important space. I do see a question from Erica.
Yes, I have so much to say. First of all, thank you so much for that presentation. I am an African American woman who birthed the baby during the pandemic, and I had the honor and privilege of taking part of the doula pilot program. And when I say it changed everything for me, it changed everything. The pandemic was such an isolating time. It wasn't my first baby, it was my last baby, my fourth baby. But I was of older maternal age. And so I needed that support. And she even supported me 4 or 5 months after the birth of my son. And so I just want you to know I'm living proof that this program has an impact and that I know it works. And I appreciate the work you all are doing. The second thing I wanted to say is if you wouldn't mind, I would love access to this presentation.
Yeah.
I don't know if you know, but a lot of maternity wards across LA County have been closing down. And so,
I know.
yes, and LA General is starting to see a more diverse group of women come in to birth their babies. And so, I wanted to know if you might be open to coming and doing something during the month of February for our OBG and maternity ward here at LA General, just to talk about some of the unique challenges that African American women face during the birthing and pregnancy process. The closure of these birthing wards is shifting the demographics of the patients and families we're working with. So I would love the opportunity for you to come in and speak to our staff if you'd be open.
I am more than open. I actually worked for patient access, Office of Patient Access for about a year, 2016 to 2017, before I switched to whole person care. So I'm familiar with the ward there and excited about the expansion. And a lot of times folks need to see us, revitalizing, remodeling our spaces to offer birthing spaces that are
Yes.
feel like we really care, right? So I'm excited to even MLK has their midwifery model that in the expansion. When I didn't get to talk about midwifery, but that is really important to us. Erica, I'm glad you were able to benefit from our doula program. Know that experience. I really had to jump in, and I became not only the dad doula after April and Bridget died, but I became the dog doula because I cared for the dog for a period of time. Because as doulas, we'll just jump right in to see where are the levers of support, are areas of support that we can help a family with. How do we help them navigate the system? You're right. We did work and we had a town hall about the closure of Centinela Hospital. I think what folks are not realizing, if we don't raise our voices around this, we're going to create backlog in the system. We're not only that, we're increasing the burden of cost. There's another team, our CMS team can talk about birth disparities are what do I want to say? I'm thinking of the word, but those long-term issues that happen for children, birth defects. I'm looking for birth defects. And so, and the importance around that, around special needs and services that end up having to be offered, and just the having parents and how that navigates and how that affects their job and their livelihood and their income. And there's so much more for us to explore in this. And that's why I left the community action team work group and how you access up. And I will share this because you can join any of our community action teams in any region. Don't have to be African American, but you do have to be willing to be a part of the change or the interest in changing these birth inequities and disparities in our community. And so super excited, and let me know when. February is kind of tight because there's so much happening for Black History Month, and there's a Mothers of Gynecology conference happening in Alabama, and I encourage folks to really get involved and learn about some of the work that we're doing across the nation to really change the outcomes, not just for Black women, because if we improve here, we're going to improve for all. Like I shared about the doulas, same midwifery. Some women want to birth at home. Some women want to birth in a birthing center. Nothing is wrong with that, as long as we create and we're building relationships between physicians and doulas and midwives. This is not a one-off. This is not I'm doing it better than you. This is how we all can work together to improve. So I have done that training at Kaiser on racism in maternal and infant health, and can do the same with you all at LA General.
I would love the opportunity, and we will work with your availability and schedule just to be able to have our staff have exposure to the training. I think would be beneficial. So we'll figure it out. But thank you so much. This was a great presentation, and the work you
Thank
do.
you.
Thank you for
Thank
that.
you. I appreciate that. I will send you my information, David. I see your comment in the chat. I have had a number of USC interns, and so looking forward to connecting.
Great. And I think, David, would you like to make a comment as well?
Sure. Thank you so much. This is so timely. Many don't know this, but the university is heavily involved in this issue. For one of our construction projects, we're putting $250,000 towards this issue because it's been identified by our community partners in South LA as something that's critical. The Keck School of Medicine is also applying for a $1 million grant. So as you were talking, I reached out to our leads that are focused on this issue. We're working with King. We're working with a number of other partners. And a number of our researchers are involved. So we definitely will reach back out to you because this is something that we feel can be a real strong partnership opportunity. And thank you so much for raising this.
Thank you. Thank you for having me. I Heather pushed. I will tell you, Heather and Felix pushed me to get here. I was like, I'm like, oh shoot, I want to rest today. But listen, this work never stops because, like I said, someone just passed last week, and it's even more than that. It is just, and our board of supervisors are really pushing forth the efforts of change because this is something that everybody has a right to, right? Birthing, pregnancy, raising children. And we want to make sure everyone is able to do it with the support and the tools and resources that are needed to have that healthy, joyous, and celebratory outcomes. So thank you.
Absolutely. We can't appreciate you enough today for showing up on your RDO. We know that you weren't scheduled to work today, but like you said, we knew this timely topic. It's been the forefront of so many conversations for a while, and it's about, maternal justice and then about the health inequity and health injustice issues. So thank you so much for elevating those for us today. I think you'll see a lot of interest in this topic, and I hope there'll be future conversations to be had. So thank you so much for joining us.
Absolutely.
Please enjoy the rest of your day off. And we'll look forward to hopefully inviting you back in the future to share some updates and other outcomes. We'd love to hear more.
Absolutely. Absolutely. Thank you.
Well, we are ready to move on with our next presentation on the topic of community health and community health inequities. Today, we're delighted to welcome Dr. Sue Kim from the All of Us Research Program, who will be speaking with us about the All of Us project. Dr. Kim, welcome.
Yes, hi, hello. The name is showing as Crystal, who is one of our research coordinator. I'm not sure quite how that happened, but maybe it had to do with the link and registration. But thank you. Thank you for this opportunity to present at this, our project at this meeting. My name is Sue Kim, and I am faculty in the Department of Population and Public Health Sciences at USC and School of Medicine. And I teach in the master's program as well as do research. My background is health service researcher. I do health disparities research as well as equity and trying to provide access and improve healthcare delivery. So the project that we wanted to talk to you about today, and I think Crystal is actually on this call as well, one of our research coordinators, about the All of Us research program. This is a precision medicine initiative funded by the National Institute of Health. So precision medicine is an emerging approach for disease treatment and prevention. And it takes into account individual variability in lifestyle, socioeconomics, environment, and biology. And so it is a radical shift in how each of us can receive the best care possible based on unique makeup. And so the goal of this program is to really improve the future of healthcare and health of the population. Next slide, please. So the All of Us research program goal is to gather data from 1 million or more people living in the US. And so the goal is to accelerate research and improve health. It's not focused on certain specific conditions like other scientific studies, but it covers a wide variety of health conditions and diverse populations. So currently anyone over over 18 are eligible to participate. And currently there are more than, actually it's around 750,000 who have actually started to participate or at least filled out some of the information, but we have data available for close to 500,000 participants. And the goal of the program is really to involve communities underrepresented in biomedical research, because the data is only good as the people who participate in these studies. So 75% of the sample actually identify with communities underrepresented in biomedical research, and close to 50%, 45% are from racial and ethnic minority groups. Next slide, please. So All of Us is working to earn the trust of the communities previously disenfranchised by medical research and engage them in safe, protective ways so that we can help to gain deeper understanding of the disease biology and more precise way to approach approaches to care. So historically, the diverse data needed to have a complete picture of health on the side of biological, environmental, behavior, and social demographic has not been easy to capture in sort of one place. So this project is really trying to bring all the data together on a single platform and making sure that it's not only secure, but it's also protected and also made available to diverse research community across wide range of settings, particularly those that come from underrepresented communities that bear a disproportionate burden of the disease. Next slide, please. So here at Keck, USC is part of the California Precision Medicine Consortium. So our group includes University of California, Irvine, UC San Diego, UC San Francisco, UC Davis, and Cedars-Sinai. So this project started in 2018, and we've been involved in this since then. And since then, we have enrolled more than 77,000 participants. And you can see here sort of the breakdown of about 50% are white, 18% Black African American, and then we have about 16% Hispanic, and then smaller proportion in others. So again, the goal is really diversity. So include racial and ethnic minorities, as well as sexual and gender minorities, people with low income or limited education, and other groups are really the goal of trying to engage. So 50% plus racial ethnic minorities and 80% plus underrepresented in biomedical research. And you can see that the age groups range from over 18 to above. And there is actually effort for pediatric population as well, where there are smaller pilot studies going on to recruit in the pediatric population. So given that we live in such, in Southern California, in an area with such diverse population, our consortium is really key to engaging the communities around us. Next slide, please. So what's involved in participating in the All of Us is that we've been recruiting at various sites, including at the Keck Hospital and clinics, and everything is available. So All of Us has participant portals. So if you're interested, you can go on the website and you can enroll and consent. And it's an online interactive consent process that you could go through. It includes authorizing the share of electronic health records data. It also involves answering survey questions. So there are initially 6 surveys asking about sort of basic information, demographics, contact information. There are lifestyle questions that ask about tobacco and substance use, overall health, personal medical history, questions about conditions. It includes questions about family history, and also healthcare access and utilization, and as well as social determinants of health. And we ask participants to come in once for the physical measurements, which includes blood pressure, BMI, heart rate, height, and hip circumference, and as well as providing a biosample, which includes blood sample, urine. There is also an option for saliva if you don't want to give blood. And then there are some people who are asked if they're interested in the wearables and digital applications that are available for a subsample of the population. Next slide, please. So our engagement efforts, there are direct volunteers, people who can just go directly to the website and volunteer. We work with HICP system so that when patients have upcoming appointments, we contact them and ask them if they're interested in participating. And if they are, then we try to match sort of their doctor visit with the study visit. We also go out into the communities and do community engagement. We also are present at the Wellness Center, and we have recruited many the Wellness Center participants to the study as well. There is a $25 gift card for completing the visit. We also offer transportation gift cards to help with travel costs to the enrollment sites. So we could meet participant at the Wellness Center, or they can come to the HICP clinic, or when we have community events, oftentimes we can do all the visits at those events with approval. There is return of ancestry results, traits, and other genetic results that are available. So I can talk a little bit about that in the next slide, please. So you receive, once you complete the enrollment, the information that are returned are genetic ancestry and trait results. So these are sort of the 23andMe type of results that you get. But with the study, we do not share the data secure, and you get that, as well as with the blood sample that we collect, genomic information is also provided. So these are genomic information that's been identified to be linked to higher risk of getting certain type of diseases. There is also, we provide within the program explanation about these results. So there's a process in place when we share results for these genetic traits that we explain fully, like what the implication is and what that means, and what the risk, sort of the definition of risk and things like that through the program. And we provide information about how DNA may affect how your body processes medicine. And so there is also genetic counseling available for those people, participants who are interested in finding more about their genomic results. Next slide, please. So our recruitment and engagement efforts, as I mentioned, we are in clinic departments at USC, including Pasadena and Arcadia clinics. We're also at the Student Health Center in the University of Park campus, and the Wellness Center. And we are actively talking to LA General Medical Center to also be able to go into their clinic space for participation. And we work with Ultimate Health as well. And we are at different various mobile and pop-up clinics or community events whenever we find out, and to engage. We do engagement efforts. We could oftentimes also do enrollment at those community events as well. So the next slide, yeah. For this group, in terms of our community partnership model, so we work with community partners to find different ways to engage their communities. So we could do lunch and learn with clinic staff. If you invite us to come, we could talk about our project and what that process is, and participation in community or clinic-based programs and outreach efforts. We go to wellness classes, patient newsletters, health fairs. There are different models of engagement. So if you're interested, you could just share our flyers, poster, newsletter, mailings, just so that there could be direct volunteers among young community members if they're interested in participating in this study. There's also more of an active role, which could be in-person recruitment. So we could send our coordinators out to the population and try to do in-person recruitment and enrollment. Or we also have resources and funds. If you want to get involved, then we could train your staff to provide this type of engagement. So there are resources available for space, staffing. If you're interested in looking into the data, you could also be a co-investigator on this effort, which leads us to what the data availability is on the next slide. So as I mentioned, there are over 700,000 participants who have sort of initiated the process of signing up for the project. There's over 400,000 electronic health records data, and then there's over 500,000 biosample that has been received. In terms of, so they also have the website there, the researchallofus.org, are for people who are interested in looking at the data. So there's a data browser where it's aggregate data, but you could find out, what's the race, ethnic breakdown, what's the age group breakdown, what type of conditions are represented in this database. And it's really to have this open platform for anyone interested in looking at the results, looking at the data, and then also for researchers who register to examine or look at start actively work on research projects. So actually between last year, there are now over 8,000 registered researchers. We have had more than 200 publications just within the last year with using this data. And when you go to this website, you can also find out what are the different studies coming out from this data set. So the goal is to really have this diverse population within the data set for researchers to really learn about the population and come up with sort of better ways to not just medicine, but community projects and community interventions to really engage within the community to provide what will be useful and help the population. So this All of Us programs would be possible without sort of the generosity of our participants and the dedication of our researchers to really promote health discoveries. So if you have any questions, I think on next slide, there are our contact information. So there's my email, and there's the direct phone number for the study. And I'll be happy to answer any questions that you have. Thank you.
Thank you so much, Dr. Kim, for joining us today and talking about this really important foundation to a lot of the good health science work we want to do. We have to have good data and representative data of the communities we're trying to serve. I don't know if we have any questions or comments for Dr. Kim. I would also invite Dr. Carla Gonzalez, the medical director of the Wellness Center and the Los Angeles General Urgent Care Clinic. I know you've been a strong proponent and advocate for the All of Us work. Dr. Carla, do you want to make any comment about why this is meaningful to you and the work that you do?
Yes, absolutely. Thank you, Heather. I want to thank the entire team of from All of Us, and really the impact that it has in bringing people together. Not only for they're allowing us this glimpse of information that is really can really lead to a lot of practice changing knowledge that will benefit the people that we serve, and You know, I'll also invite Dr. Bearden. You know, I know that there's been so many times that we're looking at the research and we're trying to find how to best take care of the patients that we serve. And the data is so limited. The studies are so limited. And the fact that we have people that are willing to participate in an effort that is in essence just not, you know, it's not good for, it's not only good for the person but good for like the greater good. I think it's just a beautiful way to you know provide like I said this wealth of knowledge that's going to just really take our care to the next level. So I am so grateful for this. I know that my my grandma passed away now, but my grandma passed away. She had Alzheimer's, she had heart disease, but before that, she did a lot of work around, you know, around research and in terms of providing, you know, her data to the pool of knowledge, and my mom has as well, and I have too, and so I just think of it as something that we can all do. We can do our part, you know, and so I'm just grateful. I'm very, very grateful, and I encourage, you know, those of you who are interested in learning more to reach out. I know you guys will be at our event, our anniversary event in April as well. So thank you for that. That'll be a great opportunity for people to connect.
Yeah, thank you, Dr. Gonzalez. I mean, your support has been valuable in terms of really outreaching to the community that we can't through just the CHEC participant. So I think, and I want to mention that, so for this study, when participants come in, so you only have to come in once. You may be contacted, but the participant portal is available so that, you know, all the communication is done through that, as well as you can go and look up information. So there's a lot of transparency in sort of what we do with the data that we collect. And there is really emphasis on privacy and security and securing the data to protect sort of our participants.
Yeah, thank you for emphasizing that, Dr. Kim. I think it's something that, you know, our population really cares about. Everybody wants to know, you know, what's going to happen with this information. And so I think the fact that there's so much transparency is very, very helpful.
Yes, thank you so much for the presentation. And we have your information here. We'll share that out with the HICP membership if you want to be back in touch. With that, we will move on to our final two presenters of the day. We're very excited to, as always, welcome back our colleagues that are helping us reimagine our campus, both from a physical location space, but also from a service model. And so we're delighted, as always, to welcome Alicia Ramos from the LA County Department of I said public health, but I meant public works. My fingers just can't help themselves. They're going to say public health all the time. But anyway, Alicia, we're delighted to have you as always. You want to step up to the podium and tell us a little bit about what's going on our campus, a few more updates.
Yes, good morning, Heather. Thank you so much. Yeah, and I can understand public works, public health, and in fact, with these projects I'm going to go through, one of our partners is public health. So these names do come up quite a bit. Okay, so we wanted to give an update as to what's going on with what is the former site of the Women's and Children's Hospital. And this is our restorative care village projects. So starting with just some context, and I apologize, some of you folks who are regulars to our meetings at HICP have seen this before. But again, just to give some context to anybody joining new. This is in our west end of the campus at the corner of Mission and Zonal. What we have in the right, circled in red, is the RCV phase 1, which has been completed, and that's already up and functioning on campus. To the left on the screen here is the blue rectangle, and that is the site where we are going to be positioning our RCV phase 4 and phase 5, and we are starting with phase 4. Next slide, Heather. Thank you. Okay, so to give some background as to how we're subdividing that lot, there's 2 projects on there, as I said, phase 4 and phase 5. Down towards the bottom of the screen, outlined more or less in this purple color, is phase 4. And that will be a 2-story building that will be jointly housing program from Department of Mental Health and Department of Public Health. So for mental health, the program consists of a mental health urgent care center that will be operational 24 hours a day. It is not intended to have overnight stays. This is really a facility that will address acute issues that may come up. And it really is sort of the crisis intervention type of program where folks who are experiencing a mental health issue can immediately be seen, urgent care in the sense of how we would know it in a medical field, but this would be specializing in mental health. Above that, there will be the public health program, and this is the residential withdrawal management. And in this program, we will be providing 32 beds that will be overnight, and folks can stay there for a limited amount of time. And that is largely for substance withdrawal, managing things of that nature. So this is the first of the two phases that's coming. We have recently contracted to bring on board the design builder, which is PanCow Builders. We went to the board in late December of 2023, December 19, board approved us. So we're off and running with the design builder. We've just started our kickoff meetings. We're starting to enter into initial design phases. But what you see on the screen there is what we envision just conceptually of how the site will be divided. So let me spend a little bit of time talking about phase 5, which is still ahead of us. We have not started or contracted for that work yet. But if you focus on the blue outline towards the upper part of the parcel there, you'll see this outlined yellow footprint. That is phase 5, and that is our psychiatric subacute facility, which will provide 128 beds. That is currently under solicitation, so it's out to bid per se. It will also be a design build, which means we hire an entity that comes on board to complete the design. What they're bidding on is just initial conceptual designs. The county puts out requirements that says we have to have so many beds. We need to include square footage to this extent. We want it to function in certain ways. And when we go through the solicitation process, we invite proposers out in the industry, which consists of contractors and designers, to say, come give us your ideas. Come to us, let us know what you know about your expertise in this field, and propose to us more information about how you could collaboratively make this a very responsive project. And it also gives them the ability to really, in real time, work with design and contractors to get the most cost-effective approach. So I just wanted to give a little bit of background as to what I mean when I say we're hiring a design builder. That's the nature of the contract, and that's what it's intended to do. So we're out for solicitation. We're out bidding phase 5. We do not expect to award a contract on phase 5 until about May or June of this year, 2024. We'll go back to the board to award that contract, and then we'll start developing that part of the site. Okay, next slide, Heather. Okay, I'm going to go back to phase 4, which is the one that we have already contracted for. So we are starting those initial phases of design development. So what you see on screen here is the 2-story building for the Mental Health Urgent Care Center and the Public Health Residential Withdrawal Management. Now, please keep in mind what I'm sharing with you here. These are concepts. So we are still yet to go through the design phase. These are conceptual ideas of what's important or what has been noted of importance when we start to develop this design. So what you see on the screen there, more or less, is the massing of a 2-story building, how it might sit on the site, and the idea that, yes, we do have surface parking there to accommodate staff and patients. But what you're seeing here in concept is that there is an importance on the landscape around the area. There's an importance in a practical sense of providing shaded parking, but there are also other landscape areas around there, which, if you note in the little bubbles, items 1, 2, 3, 4, 5, and 6, these are some ideas that have just come up that we're exploring further. The first one I mentioned, shaded parking. Second is permanent landscape around the building to soften the edge. Item 3 is what we call the outdoor patio for the residential withdrawal management facility. So I'm going to touch on this a little bit, as well as item 4 below, which is the staff outdoor area. The things we've noted, especially from RCV phase 1, is the importance of the outdoor environment and being able to have program that isn't just in the building, but can go outside of the building and offer that outdoor space, that outdoor use. It's natural that we envision providing services within a building, but we don't want to lose sight of the importance of how we use the outdoors, because it is very therapeutic. It can be very instrumental in giving relief folks to just exit. And that includes our staff. It's not just the patients that benefit from this, but the staff. They need that relief sometimes in the day. Being in Southern California, we have the opportunity to really benefit from that. Okay, Heather, if you could go to the next slide. Okay, so here's some of those ideas that we're exploring with the use of the outdoors. Up at the top, you're looking at sort of like an outdoor courtyard area we'd be creating, and that's for staff use. Could be used for lunch breaks, shift breaks, what have you, just to go outside, get some relief, enjoy the good weather. Down below is another look at what we're exploring for the use of the patients. This would be something that, again, gives them an opportunity to go outside the building, have something that they can gather in. It could become a useful space, whether it's used programmatically for classes or if it's just a relief area. But again, these are concepts, so I don't want to present these in any way saying that they're final, but these are the ideas that we're exploring right now, and that will be part of what we do for the next 3 to 4 months, finishing out the design before we go into construction. Okay, next slide, Heather. Going through schedule, just real quick. Phase 4, as I said, we've already contracted for. That went to the board on December 19th, so I've indicated that as an actual date. We've already realized it. We expect to start construction around summer this year. That's when you're going to start to see things shift and change on that site. We are aiming to complete the phase 4 project by the end of 2025, and that allows us to go into the licensing process. So around fall of 2026, that licensing process will hopefully complete and the building will be put into use. RCV phase 5, which is the larger 128-bed subacute psych facility, we are looking to award that contract in May. We would start construction at the beginning of 2025, and we are aiming to complete that building by the end of 2026. Again, we go through a licensing process, which looks like we will be in winter of 2027 when the building gets put into use. Okay, that's pretty much the update, Heather. I'll go ahead and answer any questions if there are any, but I'll let you go ahead and field those, Heather. I know time is something that you're managing.
Yes, thank you, Alicia. So do we have any, we're always excited to see the progress as these programs move forward. It's very exciting. And I think it's lovely to hear the report back of the RCV launched, over about a year and a half ago now. And it's really exciting to see the lessons learned and how that will then kind of inform future decision making. And we definitely have seen, as you mentioned, use of outdoor spaces in maybe unexpected ways. So now being an intentional design as that moves forward with us. We have a question in the chat from Ari. How tall will the building be and the number of beds?
Yeah, so thank you, Ari. And so there's 2 buildings here. The first one is the 2-story, which we expect to be somewhere around the area of about 30 feet. You're looking about 15 feet per story, 2 stories there. The second building is the subacute, which is the 128-bed, much larger. We expect that building to likely be 4 stories tall. So again, we're still in the very initial phases. So we don't have that final, but with it being about 4 stories tall, you're probably looking at something that is closer to the 60-70 foot mark if it stays at 4 stories. So these are, again, initial numbers, initial concepts, and they'll be more refined.
And we have another question from Steve. Will these be directly operated services by DMH, or will they be contracted out?
So unfortunately, we don't have our partners from DMH and DPH here. However, being a good listener from the past meetings, they do intend to hire contracted operators. So I won't go into it too much, but we will certainly follow up by having our partners here yet again for another follow-up meeting. and they can probably offer more detail, but my understanding is that DMH and DPH will be contracting for outside operators. And one other thing I wanted to add, Heather, we don't have the information today, but I'm partnering up with Isidro from Department of Economic Opportunity. He's going to be speaking later here, but we are teaming up to come back to you folks in March. We want to give a little bit more background to the local targeted worker hire program on these projects. We do have, the board did approve, and Supervisor Solis shepherded yet again the aspirational goal for the 50% local worker hire, which is higher than our policy required of 30%. So these projects will be at 50% aspirational goals, increasing those numbers. But Isidro and I will come back and we'll be doing a little bit of a focus topic on what that means. What is local worker hire? How are those hours counted? We'll give a little bit more background to what that is. So we're looking forward to telling you more in March.
Yeah, we have a lot of items already identified for our March agenda, including an update on the hiring processes, both for these projects and a report back from prior projects. So we can kind of, as you mentioned before, Alicia, we can kind of learn as we go and improve our outcomes over time. All right, so that's any other questions or comments for Alicia?
Heather, I do see one more question in the chat, which is how do people apply for construction jobs?
Oh, yes.
That's something that we will cover more in the follow-up, but just to give information as to what I know right now, keep in mind a lot of these construction jobs, it depends on the nature of the construction. These are very specialized disciplines. We're going construction ground up. So you're looking at a lot of different trades that will be involved, from foundations, grading, to steel erection, to interior finishes, drywall tiles, things like that, HVAC systems. So we have a lot of disciplines coming in here. These are going to be jobs that necessitate folks who are further into the trades, further into their career development. So for the most part, you're looking at jobs that are going to be created or exist per se, because they're already union workers, contracted workers. But part of what we'll jump into in the March meeting is describe what does that mean? We have a community workforce agreement on these projects, which means that there's a policy here that the contractors have to meet, which is local hire, right? They have to show that they are meeting 50% local workforce, but there are also connections to the union. So by having a community workforce agreement, it means if they can't meet those numbers, or if they have a contractor that is not meeting those numbers, they are routed through particular community resources, I should say community, union resources, to outfit them with those local positions, those local residents. So there's a lot of ways this comes together. So to get real direct to the question though, how do people apply for these construction jobs? It is a matter of going through the trades. It is a matter of being connected with your local training centers so that they can acquire those skills to then be eligible for the apprenticeship journeyman. There are very distinct roles of progression in construction trades, but we will bring more information about that next month. So my apologies for it being a short answer, but I want to let you know that we will have more information coming on that.
Yeah, thank you, Alicia. We look forward to that deeper dive in March to really talk about the opportunities that we see across the campus for employment and workforce development. All right, so we have one more presentation. I am so excited to welcome our colleagues from Century Housing. That includes Gilbert Gonzalez, who it is our understanding, Gilbert, that today is not only your final day, your final HICP meeting, but your final day at Century. You have been an incredible champion and advocate for the community perspective on the work we're doing here, and we will definitely miss you, but look forward to working with your colleagues going forward. So welcome, Gilbert. As always, I am surprised this will be my last time to say that. Welcome, Gilbert, and take it away.
Hi. Well, thank you so much, Heather. I just shared my screen. Are you able to see the presentation?
Looks great. Yep.
Here?
Yep.
Yes, I was going to share this at the end, but I'll just share it now. So I've been with Century for about 5 years now. I wouldn't want to work with any other affordable housing developer. Their record and their leadership is second to none. I am moving overseas. I'm pursuing dreams from many moons ago to work in the international relations field. I've been in this field of affordable housing for about 10 years, and it's been a great fit in many ways, but I'm kind of interested in exploring a couple of other paths. So it's been a great year working on this project and working with the HICP and our HICP subcommittee. I really want to thank in particular a few HICP subcommittee members, Hugo Palayo, Teresa Velasco, who I know is on today, Francisco Sanchez, Agnes Hooray, who I know is on today, Monica Alcaraz, who I know is on today, and Roberto Roque, who I know is on today. So we've worked with them over the past year and gotten feedback from them, and that's really lent itself to our project, to the design, to different decisions that we've made on it. So I want to thank them. I didn't have a chance to call them. I'm not the best at making those phone calls, so apologies I didn't call you beforehand, but I want to thank you directly. Really excited that we're going to be turning it over to my colleagues who you see on the screen here. The primary project manager will be our senior PM, Alex Stamus, and he will be supported by our associate director, Paige O'Donnell. These are both really top-notch folks. They have experience and some really other exciting and big projects, and I know they're going to do a great job as we focus on securing all of our financing for this project and then moving into construction next year. So let me go ahead and present on what we wanted to share today. This is a continuation from last month when we gave kind of an intro presentation to our community benefits agreement. Since then, we've had an in-person community workshop and want to share some of what came from that and kind of go over our community benefits agreement. I know that we are short on time. I'm going to run through the community benefits agreement and all the parts of it very quickly. I provided it to Heather and Rosa to post on the HICP website. So as you know, our recordings are always posted there. So there will be a recording of this presentation, but in addition, you'll be able to pull up the community benefits agreement, the draft agreement that we have in English and Spanish, so you can be able to explore it, more thoroughly and taking your time. I did want to share that we did have an in-person community workshop a few days ago. This was held at the Boyle Heights Technology Youth Source Center. They were a great host. We had a strong turnout, and we talked about, again, the different parts of our community benefits agreement, and then focused specifically on public art and the pedestrian and bicycle improvements that we're going to be able to hopefully partner with the city on as part of this project. These are just some images from our meeting on Tuesday. Again, I'm going to go through this quickly. There's a lot here. This is an image of the development. There's two different buildings. You see one building towards the south, right at the corner of Mission and Griffin, and one building towards the north, which is running parallel to the train tracks that are there. You all are probably familiar with the purpose of the community benefits agreement: framework for planning, implementation, and monitoring into the future. From the beginning, we've contoured our proposal and the things we're trying to do with this project to HICP and to their different focus areas. And so we've modeled our community benefits agreement in alignment with this, with those 7 priority focus areas that that HICP focuses on. And so as I go through this, you'll kind of see us go in order of those different priority areas. Ultimately, this community benefits agreement will be included in our final development agreement with the County of Los Angeles. We're in the middle of negotiating that right now. This will be a part of that. And so we've gotten feedback already from our HICP subcommittee We had that in-person community meeting I mentioned a few days ago, and we're still taking feedback in other ways. We did a community survey where we got a lot of good feedback, and so we're still incorporating that into this document. This was the draft that had been established a few weeks ago, leading up to those engagements. Couple more images. This is the south building I mentioned at the corner of Mission and Griffin, and this is the north building that it runs parallel to the railroad tracks. Health and wellness. We wanted to focus our project to make sure it addressed the concept of whole health. We see the permanent supportive housing aspect of this project as fitting into that continuum of care along the later stages of it, where folks are able to live in either affordable housing or permanent supportive housing on their own with support, but to be able to do that on their own and successfully. But in addition, we've incorporated a lot of other whole health concepts. So first of all, we have a very experienced case management team that works at and has gotten experience at a lot of our other permanent supportive housing projects, including our 26-acre community down in Long Beach, the villages at Cabrillo. In addition, we're incorporating the concept of radical hospitality into this project. I've mentioned a number of times in these meetings with Carrie Morrison at Heart Forward LA, already working on finding ways to be able to connect residents a couple of years from now when we have residents there, to make sure they're connected to the broader community and to bring the broader community into this development so that they can engage our residents and build that understanding of what this development is. It's geographically on a little bit of an island, so to also just create that broader understanding and connection to the broader community. We're also going to have on our second floor of the north building a 12-bed peer respite program. So this is for folks who are coming from more acute care situations and are ready to move out of that type of care, but may not be fully ready to, or it may not be best for them to fully move back home, whatever that might be. This is an opportunity for a short-term stay, kind of a step-down program, and we're going to work with a nonprofit that has experience running these kinds of programs, Project Return Peer Support Network, to operate this facility. Some more renderings. Community stability, converting what is currently a vacant lot into some really beautiful placemaking architecture and urban design. We're going to have 296 permanent, supportive, and affordable homes, studios, 1-bedrooms, and a few 2-bedrooms. The affordability level will be between 30% and 60% AMI for the affordable homes. It's going to be about half of the units will be permanent supportive housing with additional case management and radical hospitality support, and the other half will be affordable at 30 to 60% AMI. One of the really strong aspects of our project, and you'll see as we go through these renderings, is the variety of outdoor landscape spaces. So we really focused on this on the ground floor. It's all accessible to the general public. There's very easy and transparent access into the ground floor of the community. And then on the second floor, we have some more private outdoor space for residents. And we've created some thoughtful and nice looking ways to kind of create that distinction. We wanted to avoid gates and things that were a little that soften that kind of distinction. So you'll see a lot of trees, a lot of plants, a lot of opportunities for sitting and engaging with others. Here's some more renderings here. These circular seating areas, these are actually movable. And we wanted to be able to, if we were hosting an event or having some kind of community gathering, farmers market, to be able to have the opportunity to move these. They're movable. They're not. They're heavy, so they're not movable by necessarily a person. But with the right equipment or with the right labor, we would be able to move these and then be able to maybe open the space up more to host a community gathering. We have done some research. There's research available to us in the affordable housing development space that allows us to get a sense of the kind of impact we're going to have based on what we're developing. And so we've estimated that we're going to contribute 510 construction jobs and 147 permanent local jobs to the community. And this includes things like property management staff, facilities management staff, case management staff, different opportunities like this. And then some that kind of waterfall from those primary folks that will be working at the site. We are committed to local and targeted hiring. What we do on most of our projects right now is we work with a company. I think there's a couple of companies out there, but this organization, California Construction Compliance or Power to Workers, is one that we've had really good success with. And as the previous speaker was mentioning, this is important to us. It's definitely something we are invested in, and the way we approach that is to hire this company that knows the ins and outs of connecting people from the community, targeted workers who may have barrier to entry problems, getting them connected to these contract companies, these specialists at an entry level usually, but then working with them to make sure that connection is as successful as it can be, and getting those folks then working on our project and on other projects. And then here's just some data on what the likely impact for the tax base is. We also have an aspirational goal of 50% local and targeted hires on this project. We're going to have a workforce development kitchen. We have 6,000 square feet of kitchen space, and that kitchen space will then lend to the cafe and retail. So they'll produce the food and prepare the food that will be sold at the cafe and at the retail store. We're going to work with a nonprofit called Habitational House that has, again, experience running this kind of programming and working with folks from the community that need workforce development support in various ways to work here, and possibly including residents from our community, from these 296 households. So that would be another possible source to actually take part in this workforce development programming. We're committed to having a early notification when it's time to lease up. These projects are going to take a while. They're not going to be ready until at the soonest, at the earliest, the end of 2027. It's just the nature of how long it takes to secure financing and then to actually construct, which is at least a couple of years. But when we are near construction, we've made commitments to, in the local area, get that outreach out early so that people in the local area know early on that this opportunity for housing will be coming up. At some of the in-person workshops we've done previously, we've collected different data on places that people suggest we outreach to. We're going to work with HICP, and we're going to work with all the different community groups that are connected to HICP, like Eastside Leads and others that can help us get this outreach out and let folks know about that opportunity even before we start taking applications, so that they're ready. So they're ready for the opportunity and know how to access it. We have opportunities for large public murals. We have very prominent public mural space. There is a 3-story high, approximately 30 foot, and a 5-story high, approximately 50 foot spaces that are very prominently positioned in the building, on the building, facing the Griffin Mission intersection, that we are committed to working with the community to kind of define what we're going to end up having there in terms of community art, what that will kind of thematically be, and then working with the community to define, who might be actually completing, doing this art and what it might specifically be. With transportation, we're working to, we want to work through the Affordable Housing and Sustainable Communities program. This is a state program. It's competitive, so we have to be awarded it, but right now we're actually focused right now on that application. It's due in a couple of months. But if we're successful, then we're going to be able to do a couple of things. We're going to be able to support the Valley Boulevard Multimodal Transportation Improvement Project, which you may have heard about. It's among other things, it's a bus rapid transit that would run from Cal State LA to Union Station. Along that path, it would include a number of different safety amenities for pedestrians and bikers to make that route a lot more walkable and traversable. And then in addition, the bus rapid transit, which is all part of that. The city has a website. If you look up again, the Valley Boulevard Multimodal Transportation Improvement Project. But through this HICP program, we would be able to get some funds that could help us contribute to that project, and so then be able to show some of those contributions. We're hoping to have a drop-off area for folks to be able to drop off and pick up area people, either to make use of our site and the outdoor space, or to connect to the medical center campus, which is just right across that Mission Griffin intersection. We'll have 115 parking spaces in a podium lot. So the first floor lot of the north building, it's not necessarily visible, so you didn't see it in the renderings. It's under podium, but we would have that parking there, and then we would also have a lot of bike parking, including along Mission some temporary bike lock stands that people would who are biking would be able to come travel there, lock their bike up, and then again make use of the site or go to the medical center campus. In terms of safety, there's a number of lighting. We plan to really emphasize lighting and hope to be able to make some sidewalk, crosswalk, and intersection improvements. That is dependent on us being able to win that HICP funding. But if so, these are some of the ideas that we would like to contribute. Then in addition, just the usual safety and security measures that we take, lots of lighting. We know that this location in particular is kind of isolated and some busy roads passing by. So we'd really have focused on making sure you can see the lighting underneath, for instance, on the ground floor, right underneath here. And in general, just to encourage something that feels safer and something that people would be more comfortable walking through. Finally, in terms of environmental justice, again, we've gotten some data about the impact that our development will bring, largely in terms of bringing people, 296 households, a lot closer to job opportunities than they might otherwise be, and closer to public transportation opportunities as well. Committed to constructing in an environmentally sustainable way. There's a certification called LEED that we will definitely be certifying this project for. And then finally, as I mentioned, the landscape outdoor space. I think it's probably one of the strongest elements of our project. And in addition to providing opportunities for shade and for gathering, there's also these environmental effects that those new trees, that new landscape planting kind of contributes, including mitigating heat island effect there. So again, I ran through this quickly. You'll be able to access, if you are interested, to look more thoroughly, and we'll provide information for you to get in touch with us if you had any kinds of additional thoughts or any kinds of additional questions. I'll stop there. I hope that was fairly brief, and see if anybody has any questions.
Yeah, thank you so much, Gilbert. Let's see, we have just some congratulations and recognitions for you and all of the great work that you've contributed to, Gilbert. We wish you very well in your future endeavors. I do see a hand raised from Liz.
Thanks so much. We're late to the table here at the Eastern Los Angeles Regional Center, and I don't know if this is the place to bring this up. It's sort of a question, but it's also a proposal, and just to share with the group, the Eastern Los Angeles Regional Center, we serve around 15,000 people with intellectual and developmental disabilities in the very neighborhoods, the same area, the same community, basically. We have families, we have individuals we serve who are in need of affordable housing. What we bring to the table too, though, is that we can also bring funds. We, under the auspices of the California Department of Developmental Services, are able to invest startup funds, and also are a service provider. And so we would be able to provide case management services to individuals in these developments. So we are actively seeking partners and projects to meet the needs of our community within this community, right? So I want to put that out there, and I did put my contact info in the chat. And I know that Sophia from the State Council is also, I think, on this call, State Council for Developmental Disabilities. We are actively seeking to work in partnership and are excited about all of the projects going on here, but in particular would love to, if there's still room for us, have some conversation about partnering with you on affordable housing.
Absolutely. No, this is great. And there's probably a number of different ways that we could work together in different ways. I'm familiar with ELARC. I'm not sure if Carrie Morrison is on. We'll definitely want to connect with you in terms of radical hospitality, connect with you in terms of early notification for lease up opportunities, and then want to connect with you about different types of engagement with our various programming, including our workforce development programming. Our workforce development programming works with all different types of folks that have all different types of barriers to employment, including developmental disabilities. And so, that could be a good opportunity there as well. So we'll definitely be in touch. It won't be me personally, but our team will.
Thank you so much.
Great. Wonderful to see a potential collaboration being formed right here. Definitely love that you're able to join us, Liz, and bring that perspective of the disability community and making sure that we're fully embracing all the needs of our community members. There was a comment here in the chat about art, Gilbert, and like the art projects and bringing community representation to art that might be featured at the ESH site.
Yeah, absolutely. Let me just run through the slide that kind of displays where that art will be located. You can see the two prominent opportunities I mentioned. The one that's 3 stories, approximately 30 feet tall, is right at the corner of Mission and Griffin, kind of the central entrance to the whole development site. And then one that is just as prominent is off facing more towards Mission and towards Valley Boulevard. In the direction of Valley Boulevard, and this is 5 stories tall. So we will definitely, we're a little bit of a ways from it being the right time to start engaging community about this. We're at the earliest, we hope to be in construction for the back building and for the north building in mid next year. And then for this building, for the south building, which you see in front of you, not until early 2026, I think is the very soonest if everything aligns just right. So given that it's early to start engaging community and getting ideas, you know, that things would get stale, and so it's just not time yet. But we're definitely committed. We have our stakeholders at HICP and with the county that are always ensuring that, you know, that we're doing everything we can to incorporate that community voice. So we'll definitely have community meetings to kind of get more in detail. I know there's a county department that Supervisor Solis's office that Guadalupe has encouraged us to connect with. We thought about connecting with self-help graphics and others. And we've also at our in-person workshops been getting different types of feedback. As I mentioned at the one a couple of days ago, we had a interactive station focused specifically on the murals and getting ideas from different folks that were, again, it's early on, but we are already kind of documenting all of that. So when it is time, we can kind of look at that data and have that kind of guide us.
All right. Thank you so much for that update. See, we have, yeah, I think you've done an excellent job, Gilbert. There's not a lot of questions. It's very thorough. And as you mentioned, we will have a copy of the slides as well as a recording of this presentation available on the HICP LA website for anyone who might have missed some portion of this or want to dig in a little more deeply. With that, we are truly at time with our meeting today. We did have just one last thing that we are asking of our membership, which is we wanted to kind of dig in and hear from you about the things that you want to recommend for discussion at this table in the 10 more meetings we have in the year of 2024. So we're asking you, what are your priorities for HICP? There is a link to a survey, so you can complete this. Please click through on that link in the chat for the HICP member survey and help us identify those interests, issue areas, and conversations that you want to see supported at our HICP table. And we are going to ask you, what individuals, organizations, and groups should be more engaged at HICP, and how do we attract those new members? How we really reach out to the community leaders and residents who reside in the communities around our medical center campus and make sure that they are well represented here. We also want to know what worked for you in last year's meetings and what we should be doing differently this year ahead, and what kind of formats and presentation technologies might we use differently to make the experience as good as possible for you. And finally, those recommendations for topics, for speakers, for panels, for discussions, and possibly even for site visits that you would like to see in the year ahead. We've got 10 more meetings to go, and we want to make sure they're meeting your needs and encouraging always a rich conversation. So we're asking for you to please put those in the chat, complete our survey, and we look forward to bringing fresh ideas and perspectives to share with you throughout the many meetings ahead. And with that, we will end our meeting, and I'll ask Liz, you've got your hand up. What would you like to chime in with?
Oh, I appreciate that. I feel like I just walked in the room, but I just want to offer, certainly, again, I look forward to being part of this group. Thank you for being so welcoming. The Eastern Los Angeles Regional Center would be delighted to provide an overview of regional center services and how we work within the East LA community. So just want to put that out there if there is an interest. Thanks.
Yeah, thank you so much for that offer. We will bring that to our co-design committee. We have a co-design committee of members of the HICP family. They meet about a week after this meeting to design next month's agenda and invite speakers. So we will definitely add that to the list, Liz, and see where that might fit in one of our upcoming meetings. So thank you so much, everyone, for joining us today. Go have a wonderful rest of your Friday, weekend, and of course, month of February. Please do something special on Leap Day to acknowledge 2/29/24. And we'll see you all right back here on March 2nd at March HICP meeting. Thank you so much. And goodbye, Gilbert. You will be missed.